name is Cherish. I am your nurse today, and I'm just going to give you a little bit of education before you get discharged with your baby to go home. First things first, I like to talk about how you can take care of yourself following giving birth. As far as activity, the first thing you want to do is avoid lifting anything heavier than your baby and limit stair climbing as much as possible. Some short walks are okay in order for you to prevent clots, but you are bleeding more and you are in a state of healing, so definitely try to rest as much as you can. For as far as driving, I need you to not drive, so make sure that you have a ride going home and a ride anywhere that you're going for the next 2 weeks, and make sure that you aren't lifting that car seat because it will be a bit too heavy for you in these early stages. Infection, as far as infection, the signs and symptoms you might expect would be discharge, a weird drainage that has like a pus, foul smell. If it's green, yellow, or a weird color in general, that might be an issue. And then as well as swelling, tenderness, and redness. These are all signs of infection. So if you notice any of these, definitely let your provider know. As far as medications, anytime you're going to take a medication, always make sure that it is safe for breastfeeding, assuming you do plan to breastfeed the baby. I know that NSAIDs such as ibuprofen and Motrin, these are okay for you to use. They can be taken for some pain that you may be experiencing, like cramping or any inflammation that you're probably experiencing since you're so recently postpartum. As far as your mental health, postpartum depression is a very serious thing that we need to consider as you go home. Baby blues are normal. This is when you would just get episodic tearfulness with no identifiable cause. But if these feelings you notice are persisting for more than 2 weeks, definitely reach out so we can make sure that everything is okay. Some experiences that you may have if you were depressed include no joy, not eating, if you're having intrusive thoughts or excessive worry, and you lose the ability to care or to concentrate very well. These are all not very good signs. But take immediate action if you begin having hallucinations or if you start having any ideas that you may want to hurt yourself or your baby. Definitely contact a doctor and let us know so we can get treated and make sure that everything is okay and that everybody is safe. Some symptoms that will require immediate medical action if you were to notice them is if you are bleeding heavily, if you're soaking more than 1 pad in an hour, that is concerning. If you're having intense pain, especially if it's sudden, comes on suddenly. If you're getting a fever that's over 100.4, constipation, or decreased urine output if you notice you're not peeing very much. These are all things that you would definitely want to let your provider know if you notice any of this happening within the next couple weeks. And then if you don't notice anything changing rapidly within the next couple weeks, then you probably are fine, but you will still need to come for a checkup with your doctor about 2 weeks from now. Do you have any questions regarding just your personal maternal care? No? Okay. Would you like me to move on to some care for your newborn? Alrighty. So as far as caring for your baby, let's start off with feeding. So the normal intake for your baby is about 50 to 60 milliliters. We like to encourage you feed the baby every 3 hours or so, maybe 2 or 3 hours. Try to watch their mouth because they may have some yeast or some white stuff building up in there. So definitely keep an eye out for that because we don't want him to have candidiasis. As far as normal daily output, during the first couple of days, the baby will probably void about 2 to 6 times each day, and you can expect maybe 15 milliliters per kilogram of weight that the baby is. After that, though, you can expect about 5 to 25 voids each day, and the volume will go up to about 25 milliliters per kilogram of weight that your baby is. As far as umbilical cord care, you're going to assess the stump And the base of the cord, you don't want to see any redness, any swelling, or any drainage. Check that every time you change the diaper, and when you put the diaper on, be sure to fold it down and make sure that it's not further irritating the umbilical cord. That clamp that is on is going to stay in place for 48 up to 48 hours. 24 to 48 hours is more accurate. Do not submerge the umbilical cord in water until it has fallen off, and definitely do not pick at it. The baby should not be crying when it gets touched. It should not be painful, and you should expect the cord to fall off in about 10 to 14 days. So within the next couple weeks, it should fall off on its own. Bathing and skincare for your baby. You're going to need a towel, 2 washcloths, some mild soap, and you want to keep him in a infant safe tub with some warm water around 100 degrees Fahrenheit. Definitely be gentle when bathing. You don't need to scrub or wipe too hard unless there's like that specific piece of dirt or something. You may notice newborn rash, also known as erythema toxicum. You don't need to do anything if you notice this rash. Just try to keep it clean and dry as you probably normally would. And then as far as if they get dry skin, you want to apply a small amount of lotion. Make sure it's fragrance-free, hypoallergenic, and just apply a little bit of that to make sure that their skin doesn't get too dry. A very important thing to keep in mind is safe sleep. SIDS is a unknown cause of death in which the baby will have problems with breathing while sleeping. So it's important to know how to make sure they are sleeping safely. Most important thing is make sure they are always sleeping on their back in a crib that has absolutely nothing in it. You might want to keep the baby in the same room, but not the same bed. A very much separate, empty crib is what they need to sleep in for about 6 months to a year, ideally. Make sure it's a music crib that is meeting the safety standards, that has a firm mattress and that fits the crib very well. Definitely avoid overheating by overdressing the baby. Don't think that he needs to be bundled up when he goes to sleep. Make sure that he is dressed appropriately for the temperature of the house. And try to use pacifiers during sleep because this can reduce the risk of SIDS. And also don't smoke around the baby, and supervise whenever they are doing tummy time to make sure that nothing is going wrong. Thermoregulation. This is just knowing what temperature is good and what temperature is not okay for your child. If you take the temperature axillary, it's through the armpit, you will notify the doctor if he has a fever of 99.5 or higher. A normal temperature for an infant would be 97.7 to 99.4. So definitely if it's getting too high or too low, definitely try to do something to fix that. If it does get too low, you can do things like skin to skin. A warm blanket can help as well, just doing things that you can to help them regulate because they're too small to regulate their own temperature at this stage. In order to check the temperature, you're going to take the thermometer and place the silver part right underneath the armpit and hold their armpit down and just wait for it to give you the temperature. Definitely don't push too hard. Make sure you're not going behind the armpit to make sure that you're really in there and getting an accurate temperature reading. Let's see. As far as newborn jaundice, thankfully your baby does not appear to have that right now, but it does appear in 85% of full-term newborns. A way to prevent it is through frequent breastfeeding. You want to avoid supplementing the baby if he's not dehydrated, because then the supplementation isn't quite necessary. And if you notice that he is not having stools, he's not feeding very well, and if he's very sleepy and very yellow, then you will want to let the doctor know because he may need a little bit of additional assistance. Infection control, that's also a very important thing with our newborns. Make sure you are thoroughly washing hands as well as thoroughly washing any toys, bottles, things that the baby may touch a lot or even put into his mouth. Do not allow any sick people around your child. Don't let them kiss him, and make sure people always wash their hands before touching your baby, especially if they're going to be touching his face. Airway clearance. If you notice that there's a lot of stuff in his lungs, you might want to use the bulb syringe to clear any excess mucus, and make sure that you're not overusing it because the bulb syringe could cause some nasal swelling. So only do it when it's necessary and not just all the time. Some signs and symptoms of infection when it comes to the newborn are a little bit different than when it comes to an adult. So if you notice that his breathing is getting a little bit fast, he's tachypnic, then that would be a thing to worry about. If his temperature rises too high or too low outside of the range that we mentioned, that could be a concerning sign. Retractions and nasal flaring and cyanosis are all signs that oxygenation isn't doing very well and his perfusion isn't going very well. So you might want to do a little bit of further investigation if you notice these things in your son. A few symptoms that would also require immediate medical attention if you were to notice these in your child include refusing to eat or not eating very well, as I had said earlier, if he's having unusual sleepiness and is inconsolable, if the skin around his face and mouth is turning blue or excessively pale, that's something concerning. If there's a lot of coughing or projectile vomiting, we don't want that. If you notice difficulty breathing or redness in the stool or the urine, that's not very good, as well as diarrhea or nasal flaring. These are all things that if you notice them, definitely let a doctor know. And then as far as appointments moving forward, you will want to come in for the first week visit when the baby is around 3 to 5 days old, and then also come in at 1 month, 2 months, 4 months, and 6 months. These are all of the routine follow-up appointments. It's just to make sure that everything is still going well and we can make sure that your baby is doing well. Do you have any questions or anything else I could tell you? No? Okay, well, I am very glad that you seem to be well prepared to take your baby home, and I hope you guys have a wonderful, safe trip home, and congratulations on your child.